Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into managing diabetes in pregnancy, tips for a safe delivery. You'll discover what you need to know to keep you and your baby safe. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. This causes blood sugar to rise. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. If not managed, gestational diabetes can lead to risks. These include a larger-than-average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Let's talk about what gestational diabetes feels like, because some signs might seem like normal pregnancy discomforts. You might feel thirstier than usual, even after drinking plenty of water. This happens because high blood sugar makes your body flush out sugar through urine, which dehydrates you. You're reaching for water all day, maybe even at night. Another sign is frequent urination. High blood sugar makes your kidneys work harder, leading to more bathroom trips. Pregnancy already increases urination, but waking up multiple times at night to pee could be a red flag. Fatigue is also common. If you're exhausted despite resting, it might be because your body isn't using sugar effectively for energy. Blurred vision can happen too. High blood sugar affects the fluid in your eyes' lenses, making things look fuzzy. Lastly, genital itching or frequent infections like yeast infections can occur, as high blood sugar creates an environment where bacteria thrive. So, how can you manage gestational diabetes to ensure a safe delivery? First, focus on a gestational diabetes diet. Eating for gestational diabetes means choosing low-glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. Try eating smaller, balanced meals every few hours to avoid blood sugar spikes. For example, pair a piece of fruit with a handful of nuts or have Greek yogurt with a sprinkle of chia seeds. Avoid sugary drinks like soda or juice, and stick to water or unsweetened teas to stay hydrated. Exercise is another powerful tool. Walking for 20 minutes a day or doing prenatal yoga can help your body use insulin better. These activities are safe for most pregnant women, but always check with your doctor first. If you're not used to exercising, start small, maybe a 10-minute walk after lunch, and build up from there. Staying active not only helps control blood sugar, but also boosts your mood and energy levels. Plus, it can make delivery easier by keeping you strong and flexible. Testing for gestational diabetes is key to catching it early. If you notice symptoms like thirst or fatigue, talk to your doctor right away. They'll likely recommend a gestational diabetes test, usually between 24 and 28 weeks. This test involves drinking a sugary solution, and they check your blood sugar after an hour or two. Some women need a follow-up test called the 3-hour glucose tolerance test for a more detailed check. Keep a journal of your symptoms or habits to share with your doctor. Note how often you're thirsty, how much you're peeing, or what you're eating. This helps them make a better diagnosis and tailor a plan for you. Sometimes, diet and exercise aren't enough, and that's okay. Your doctor might prescribe insulin or oral medications to keep your blood sugar in check. These are safe for pregnancy when used under medical supervision. If you're prescribed medication, follow your doctor's instructions exactly and check your blood sugar regularly with a glucometer. This little device is easy to use. Just a quick finger prick to track your levels. Your doctor will show you how and tell you what target numbers to aim for, like keeping fasting blood sugar below 95 milligrams per deciliter. Let's bring this to life with a story. Meet Emma, a 30-year-old mom in her second trimester. She noticed she was thirstier than usual and thought it was just pregnancy. But when she started waking up 3 times a night to pee and felt exhausted despite sleeping, she got worried. Emma told her doctor, who ordered a gestational diabetes test. Sure enough, she was diagnosed with gestational diabetes. Emma worked with a dietitian to plan low glycemic meals, like quinoa with roasted veggies and grilled chicken. She also started walking 20 minutes daily in her neighborhood park. By delivery, her blood sugar was under control, and her baby was born healthy at 7 pounds, 2 ounces. Emma's story shows that taking action early can make a big difference for you and your baby. What about pregnancy diabetes risks if gestational diabetes isn't managed? A larger baby can lead to a tougher delivery, sometimes requiring a C-section. Macrosomia also raises the chance of shoulder dystocia, where the baby's shoulder gets stuck during birth. High blood sugar can also increase the risk of premature birth, which might mean your baby needs extra care in the NICU. For moms, there's a higher chance of developing preeclampsia, which can cause swelling, headaches, and, in severe cases, seizures. Long-term, women with gestational diabetes have a higher risk of type 2 diabetes later in life, but managing it now lowers that risk. Your baby might also face a higher chance of obesity or diabetes as they grow, so controlling it during pregnancy is a gift to their future health. Monitoring your health is easier than it sounds. Your doctor might ask you to check your blood sugar 4 times a day, once when you wake up and after each meal. This helps you see how foods and activities affect your levels. Apps like MySugar or Glucose Buddy can make tracking easier, letting you log meals, exercise, and blood sugar readings in one place. Share these logs with your healthcare team during checkups. Regular prenatal visits are also crucial. Your doctor will monitor your baby's growth with ultrasounds to ensure they're not getting too big. They'll also check your blood pressure to catch any signs of preeclampsia early. Let's talk about delivery. With gestational diabetes under control, most women have a safe vaginal delivery. If your baby is larger than average, your doctor might discuss inducing labor a bit early, around 38 or 39 weeks, to avoid complications. A C-section might be planned if there are other concerns, like if your baby is very large or if you have preeclampsia. Either way, managing your blood sugar throughout pregnancy sets you up for a smoother delivery. After birth, your blood sugar usually returns to normal, but your doctor will check it before you leave the hospital. They'll also test your baby's blood sugar to make sure they're stable, especially in the first few hours. Here are some extra tips for managing diabetes in pregnancy. Get support from a dietitian or diabetes educator. They're experts at creating meal plans that work for you. Join a support group, online or in person, to connect with other moms going through the same thing. Stress can raise blood sugar, so try relaxation techniques like deep breathing or meditation. Even 5 minutes a day can help. Sleep is also important. Aim for 7 to 8 hours a night to keep your body balanced. If you're feeling overwhelmed, talk to your partner, a friend, or a counselor. You're not alone, and asking for help is a strength, not a weakness. Let's wrap up with a quick recap. Today, we covered managing diabetes in pregnancy, tips for a safe delivery. You learned about gestational diabetes symptoms, like thirst, frequent urination, and fatigue, and how to spot them. We talked about the gestational diabetes test and why it's important to catch it early. You got practical tips like eating a gestational diabetes diet with low glycemic foods, staying active with walking or yoga, and monitoring your blood sugar. We also covered pregnancy diabetes risks, like macrosomia and preeclampsia, and how managing diabetes lowers those risks. Finally, you heard Emma's story showing that with the right steps, you can have a healthy pregnancy and delivery. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below. Have you noticed any gestational diabetes symptoms or tried these tips? Let us know your story. Subscribe for more videos on gestational diabetes symptoms, diet, and tips. Check out our playlist on gestational diabetes management for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching, and we'll see you in the next video. Disclaimer: this video is for informational purposes only and not a substitute for professional medical advice. Always consult your doctor for personalized guidance on managing diabetes in pregnancy.